When Alyssa and Josh Riel got married, they couldn't wait to start a family. And within the year, they were expecting. But pregnancy did not go as planned.
It had gotten to the point where I could barely drink. Like, I couldn't drink out of a straw, I would choke. I gained 1 pound my whole pregnancy.
It was Alyssa's first pregnancy, and she didn't know what was normal. She had no idea what was lurking, threatening the lives of both mom and baby.
I feel like I'm suffocating when I lay down. I can't breathe.
At 36 weeks, an ultrasound revealed the unthinkable.
I was scared. I was mad. I tried not to freak out right away, but I did.
Large tumors on her neck and chest. Life changed in an instant, and suddenly her life and her unborn daughters were in jeopardy.
My role is to organize the care of these high-risk patients.
Nurse Sarah Garcia got the call and quickly got started, bringing together teams from anesthesia, cardiology, the ECMO team, labor and delivery, blood services, and more.
The mass in her chest was so big that they were concerned that if they did general anesthesia and her structures collapsed, that the mass would obstruct her airway below the breathing tube that they would use for her.
Clinicians suspected Hodgkin's lymphoma. She would have to deliver before fighting the cancer.
Everyone was like so informative, like, this is what's gonna happen, this is our part in this ordeal, like, this is what we do first, this is what they're gonna do next.
Her situation was that it was in her chest, it was in her lungs. She had and has blood clot in her throat. She couldn't push, she would have been too much pressure. That was out of the option, it was C-section, that's it.
We always plan for the worst case scenario, but we expect the best case scenario.
CPR was also out of the question. Compressions could rupture the tumor, spreading the cancer. That's when the ECMO team came in.
So the ECMO takes the place of, it's basically bypass, takes the place of the lungs, and they're able to oxygenate the blood externally and then return it back to the patient.
Like, I knew she was going into good hands when I left her, and it was kind of like, she'll be okay. You have to stay optimistic.
It was not the birth that anyone planned, but it was beautiful.
To be able to be the person to bring that baby to the family, it was such an emotional time.
Ayla was born via C-section, not on labor and delivery like most newborns, but in a special operating room with a team of specialists at the ready.
They were all waiting, and we came around the corner, and they were, her husband Josh was in the hallway and saw us first, and I mean, I can't even describe that moment, how wonderful it was to be part of that for that family. It was amazing.
Everyone was so on top of everything, and like, what one person said followed up by what the other, like, nothing was ever, oh, there's a little bit of a gap there, like, everything just flowed. Like, they all knew each other's plans.
It makes you feel good that you're able to bring smiles to people's faces when they're in a very complicated, difficult moment.
If this was me and my family, and this was the birth of my baby, that's really what it's all about as far as nursing goes.
I like to help people, and nursing really gives you that opportunity.
We're so thankful that we were there for them to have the knowledge and experience, and to know that the people we had behind us, things like these bring you even closer. You don't think you could be, but it really does just make you more grateful for what you have and who you have.
I feel like with nurses, like, they just kind of jump in and they just have like that special, they just do it. They're amazing.